Well, we have been covering the weekly rallies outside of Toronto's Queen's Park legislature of severely normal people, often working class people, begging the government to let them go back to work. There are many very thoughtful arguments made, from the abstract idea of freedom to the practical idea of people have to pay their bills, and every argument in between. But alas, from within Queen's Park, it seems unanimous. Every politician is enjoying this lockdown just a little bit too much, except for one MPP. That's what provincial politicians are called in Ontario. Let me read to you from his website, and let's see if you can guess who it is before I introduce him to you. He's on hold, and we'll interview him via Skype in a moment. Here's what his website says. On March 13th, we declared a state of emergency. I was in support of giving the Premier the authority to make swift decisions to handle the COVID-19 outbreak while the legislature was in recess. Now, 3 months later, I can see this power has been abused to the detriment of the people of Ontario. Let me read just one more paragraph. Throughout this outbreak, we have seen groups come together in defense of democracy with the hope of keeping our economy from ruin and to protect those left behind by our shuttered healthcare system. Phone call after phone call, I began to learn the damages this lockdown has created for countless people in my riding, from business closures to bankruptcies, ignored medical procedures to unnecessary deaths. None a result of COVID-19, but rather the orders put by this government to fight it. Has the cure become more dangerous than the disease? Very thoughtful questions. And it won't surprise many of you to know that the MPP who wrote this is our friend Randy Hillier, the MPP for Lanark, Frontenac and Kingston, who has represented that riding and its predecessor since 2007. What a pleasure to talk with you today, Randy. Welcome back to the program.
Great to speak with you today, Ezra.
Well, likewise, and hearing those, and your website goes on for several more paragraphs. I would invite everyone to read it for themselves at randyhilliermpp.com. You really make the case to lift the emergency powers, because I really think that flatten the curve for 2 weeks has turned into flatten everything for 3 months, hasn't it?
Well, we certainly have flattened our economy. We have certainly flattened our access to health care and medical attention. We have suffocated and killed off social interactions, which are exceptionally necessary for people, and we've killed our education system. So we have flattened a lot of things, Ezra, and it has caused significant harm, significant injury, significant consequences to a great many people who are really not at risk to any great degree. We know a lot more about the virus now than we did back in March. And, and if you're elderly, if you're in confined locations, if you have poor health, you are at exceptional risk. But that doesn't apply to a great many people, or the majority of people in Ontario. And they are now facing significant hardship. Like I said, the numbers of people that we've talked to who can't get necessary medical attention and who are in pain and suffering as a result are not considered during this state of emergency. And it really is, it's time, it's long past time, in my view, that elected members of the legislature are permitted once again to engage in discussion, engage in debate, and pass approval or disapproval on behalf of their constituents on government policies.
Randy, I remember those early weeks. No one knew a lot about this virus because you couldn't trust China. Even if they were telling the truth, you really couldn't trust them. And what every public health official said was, we have to flatten the curve. And I mentioned that phrase. It doesn't mean we're not going to get sick. It means we have to slow down the infectiousness of the disease so it doesn't overwhelm the hospitals. They never said stay at home so you don't get sick. It was so that we don't all get sick at once. But here I'm showing on the screen now a graph published by the Government of Ontario of the number of outbreaks. We never reached that overload point. We have absolutely flattened the curve. It's lower than even the best case scenario models predicted. The new rate of infections is as low as it's been in 2 months. So the rationale has changed, hasn't it? They said, don't overwhelm the hospitals. The hospitals are ghost towns now. Why are we still in lockdown?
Well, that's right. You know, we've met the objective. The objective was not to overwhelm our healthcare system, and we beat that in spades. And kudos to the government for that part of it, because they have, especially in the early days, when there was so much uncertainty, when there was so much misinformation, when there were so many unknowns, you had to take a precautious attitude towards this and a very cautious approach. But, you know, evidence has been revealed, and facts and evidence are apparent now. But we achieved the objective. Our health care system was not overwhelmed. Our hospitals are near empty. Our emergency rooms are empty. Our doctor practices, you know, physician practices, are still not, many of them are still not operating yet. And so we achieved everything that we set out to achieve. And we know that those, you know, the peak of this was mid-April. And we've seen since that time a very steady decline. You know, we never, the most we ever had was 1,000 people in our hospitals, where we added additional capacity of like 15,000. So, you know, that's been achieved. Why are we still in this state of emergency? Why are elected members not permitted to discuss, hear the advice, and pass judgment on as we're elected?
Yeah,
you know, it's unwarranted and it's unjustified. Over 3 months later, and now talk today, coming out of Queen's Park, is they're going to extend it through July for this state of emergency.
You know, we couldn't trust the numbers from Communist China, but now we have so many numbers from Canada itself and the United States and even Italy, which sort of got the virus before we did. And it is not a virus that affects the young in a great manner. I don't think there's a single Canadian under age 20 who has died from the virus. I was looking at...
well, we know that's true. There is nobody under the age of 19 has died as a result of COVID. And if you look at the Ontario numbers, you know, it is well over 90% of people who have suffered fatalities are over 60 and with other serious health problems as well. You know, in the area that I represent, Ezra, where the two health units has a population of about 400,000 people. And this is, I think, important for people to realize, because different areas are affected and impacted differently. But in this area of 400,000 people, we have had 3 deaths from COVID outside of long-term care, and the average age was 86. And, you know, just to keep that in perspective, you know, the life expectancy in this country is 82. You know, as much as we would like to live for a long, long time, you know, there is an end date for us all. And if you are sick and elderly, you know, the virus is a far greater issue, and elderly people with other illnesses ought to be taking greater precautions.
Yeah.
But to close down our education system, to close down our healthcare system, to close down our economy, reduce our standards of living, reduce the social determinants of health. You know, we have to look at that and look at it critically. And is this a reasonable approach to continue on?
Yeah.
Then passing judgment on those early days, because I do think there was a lot of good things done in the early days, some not so good things as well, but that was more from the unknowns and the misinformation. But is it justified to continue down that path today? I don't believe so.
Well, I mean, you mentioned the average age in your district, 400,000 souls, the average age of the three deceased in the mid-'80s. And of course, each of those deaths is a tragedy for the family, but it points to where we ought to point our care, as opposed to closing down all the schools, closing down all the sports, closing down, I mean, it's summertime now, all the summer activities for kids, camps. It's just madness to me that if the people in jeopardy are our grandparents and great-grandparents, give them 90% of the attention, 90% of the care, 90% of the worry, and let the kids run around. It boggles my mind, and here's my question to you. You know Doug Ford a lot better than I do. You were originally elected as a conservative, and you know the man, and you knew his late brother. Those were reasonable business people, common sense. They had their feet were on the ground. They weren't part of this elite, bossy, authoritarian class of public health officials and I know better than you types. How is it that Doug Ford is now not only listening to what the elites say, but disparaging those Let Us Work protesters, calling them yahoos and whatnot? What's happened to Doug Ford, the man who used to stand up to the elites and the bossy people?
Yeah, listen, the referring to people as yahoos for having a view and having an opinion that is contrary to your own is, it's contemptible. And, listen, I think Doug is a good individual. I also believe that he's placed all his confidence, all his faith in, and misplaced his confidence and faith in only public health officials. And as much as public health is important to us all, important to society, there's other aspects of our lives that are also important that ought to be taken into consideration. And he's made this choice that not only, most of us expect experts to provide guidance and advice, but we don't expect experts to make the decisions on our behalf. And this is what Doug has done, and he has said it clearly. Cabinet will debate and discuss policy, but the COVID command table, that unaccountable, that unelected group of public health officials who we won't even identify, will make the decisions. And they're not suited, they're not competent to make decisions about the economy, about our education, about our social interactions. They're public health officials. As it reminds me, of Stephen Leacock's old saying about experts. An expert is somebody who goes to university to learn more and more about less and less every year, until such time that they know everything there is to know about very little. And, and we need to understand that. That's why our governance, our country has been so blessed and so effective. Is we listen to, in a democracy, we listen to everybody. Yeah. We hear various perspectives and various diverse opinions, and we use that knowledge to make a policy that is beneficial to everyone. We don't look at just a singular facet of life to make all our determinations on.
Yeah. Well, I tell you, show me someone who's calling for a lengthened lockdown, and I'll show you someone who hasn't missed a paycheck. The average paycheck for a lot of these public health officers is in the $300,000 plus range. Not only are they enjoying a healthy living, they're having the time of their lives. People listen to them. They're celebrities on TV, and as you say, they don't have any messy business like actually having to listen to constituent concerns. Hey, I got one last question for you, Randy. And by the way, thank you so much for joining us. And I would refer everyone to your website, randyhilliermpp.com, where you refer to a petition on the subject. I know informally that there are close to half a dozen Conservative MPPs who share your skepticism of this never-ending lockdown. First it was 2 weeks, then it was a month, now it's 3.5 months. Do you sense that there is anyone else in the legislature, either within the government benches or perhaps in the opposition, who would say enough is enough? And the reason I ask that is because the Emergency Act under which Doug Ford and the other political leaders in this country operates, they have sort of fail-safes in them. And if a certain number of MPPs or federally MPs object or want a do-over or another vote or want to hold things to account, it's possible to trigger that accountability with a handful of other MPs. Do you have any indication that Conservatives, NDP, or even Liberal MPPs share your growing concerns?
The people are sharing those concerns, Ezra. However, party discipline is a significant component of every elected member's determinations. I'm fortunate that I'm independent, and I can speak my mind without fear or favor. And let's not be. There is still a significant public opinion as well, Ezra, and it goes back to what you just previously said. There are a lot of people in public service and in political life who continue to derive their full incomes, continue to have their pensions building, and not having to go to work. And that's a pretty good life. They're not suffering in that regard. And there is a significant amount of fear that still is there. For the last 3.5 months, people have been faced a barrage every day, a continuous barrage every day of the fear of COVID. So let's not be, we can't dismiss those circumstances. But I do know there are other MPPs who share my views, but however, they're not able, because of party discipline, to speak as freely as I am.
Yeah. Well, we sure are glad that you are there speaking freely, and thank you for joining us today. I know you're out you're riding, and you're in a somewhat public place there, so I appreciate you jamming us in for this interview. Yep. It's so nice to see you again. It's so good to hear a blast of common sense. I will refer people to your website, randyhilliermpp.com. We'll have a link to that under this video. It's great to see you. I hope we can keep in touch, not only on this issue, but other issues. I feel like you are, as you say, you have the liberty to speak your mind, whereas most MPPs don't. So it's great to see you.
Good chatting with you, Ezra, as always, and hope to keep in touch. And being independent does provide me that opportunity, and I'm not going to lose sight, and I will take advantage of having that freedom to speak independently.
Right on. Well, thank you, my friends. Stay safe, stay healthy, and keep fighting for freedom. Right on.
Right on.
There you have it. Randy Hillier, MPP.com. He is the member of provincial parliament for Lanark, Frontenac, and Kingston, and has represented that region of Ontario since 2007. That's an excerpt from my daily show, the Ezra Levant Show. Every day I do a monologue on the news of the day, then I interview an interesting guest, and then I read my hate mail. You gotta subscribe. Go to rebelnews.com.